It's a very profound question. The reason why I say this is the answer has changed all along my life, and my hematology career spans from 1990 to now. So you can see nearly 30 years. How I responded and reacted in the 90s is a little different today. Firstly, whenever I have a difficult medical problem, the first burning question in my mind is, do we have a treatment for this problem? And for that, you need a correct diagnosis. And once I have that, then obviously I will see how best I can get that treatment for that patient. But having said this, in the last 3 decades, hematology has been revolutionized in our country. What we have today is the best as we have in the West, which is not the case 30 years ago. So one struggled to actually meet the requirements of the best available treatment, which is called the standard of care the world over. But today, I'm happy to tell you, we have all of it. And we have the best from Europe and the best from North America. Yes, financial toxicity is one area which needs to be addressed, which our pharma industry is doing a great job, because they are obviously bringing in generic molecules which are affordable. So we are in a much better space with available medicines, and our armamentarium to attack these difficult medical diseases has improved vastly. The hospitals, diagnostic facilities, nursing facilities, supportive care, right from the blood bank to the laboratories, have tremendously improved. So put all this together, there's hardly a problem that we can't deal with. But having said this, there is some orphan diseases, some other rare diseases for which we still encounter a lot of problems in managing them.
Initially, it was affecting when I was a student doing oncology or in medicine, and then when I started my private practice, I was little emotionally attached to the patient. But I think over a period of time, one gets used to it. It is a part of the you can't say business, but practice. So emotions is different, and private practice or patients are different.
Basically, being cancer surgeon, we feel so many non-medical problems. First, to start with, the myth about the cancer, that is, cancer is cancelled. So whenever patient comes with the diagnosis of cancer, the whole family and patient is totally depressed. We have to infuse a lot of confidence. We have to generate them. We have to explain them about the type of treatment and the result of the treatment. And that is very, very depressive sometimes. And in fact, being cancer surgeon, we have to become the psychotherapist initially.
I remember long back there was one patient of nearly 40 years suffering from cancer of the tongue. The surgery was done first, and then according to reports we need to give radiation. But all his reports were telling us that his disease will recur very fast. Therefore we started the treatment very early. But surprisingly and unfortunately, within first week of radiation, that patient developed a disease recurrence. We took confidence of all the relatives in this case and informed that the life has become very shortened. He is not likely to survive for more than 6 months, a year. But somehow, unfortunately, his mother was behind the door. She also heard the same thing. On the same day at the night, she gave me a phone call and shouted that how you can say that my son will die. I will burn your degree, I will burn the hospital, I will burn the medical college. And that statement on the phone was very shocking for me. I called my director as well as the administrative officers that this thing has happened. They told me, doctor, just don't worry, this happens in life, because she is a mother and she got a heart of a mother. How a mother can tolerate the death of his son, and therefore she is telling in this way, you just don't worry. Next day when I went to hospital, everything was calm and quiet, there was no problem. But such types of situation happens in cancer patient, because in our experience 33% of the patient they survive for 5 years and rest they die within a period of 5 years.
Unfortunately, we see difficult medical situations pretty often in our profession, especially as doctors and especially as cancer specialists, you do have to create some sort of mechanism to deal with this. Oftentimes when I go home, you're just thinking about the patient and patient outcomes, and it can affect your personal life and your family life if you're not careful. I think I deal with this situation by some extracurricular activities. I run seriously. I wouldn't say seriously, but a few times a week, and try to engage myself with music. So I think you need to have these sort of distractions to keep yourself from getting totally bogged down by difficult situations.
I think the most important thing is, first of all, there are two extremes of this. One, where the patient is diagnosed with cancer and we have to reveal the diagnosis. Other is the patient is almost going to, in the last few days or weeks which are left with. So both the situations we'll have to explain, because accepting that you are having a cancer is something which is very difficult for patients and their relatives to accept, but in a way that they can understand in the simple language. And first of all, we reveal the diagnosis to the relatives, and later on take the patient itself in the confidence that this is, you are having this cancer and this may be properly cured or controlled by the proper treatment. Hence that is something which helps us to conquer this. Whereas at the same time, for the patients who are in the end of their life, I think their most important thing is to make them more comfortable and try to relieve their sufferings. Hence the pain, nutrition, these are two things which are very important. Third, the team, as a team, the psychologist also plays a very important role to counsel them and relieve them of their anxiety and whatever they are suffering from. So these are the very important things that we have to answer the patients.
Actually, it is really difficult to handle the situations when some difficult medical conditions come to us. But with experience, we usually learn how to manage it. And definitely, if there is some unfortunate thing happens, it definitely affects us personally.
So, dealing with difficult medical situation, I believe that is a part of the training that we receive, and as we evolve, obviously we keep on learning. So, as you said, yes, obviously, nobody as a doctor, I cannot feel completely detached that if my patient is not doing well, obviously it is bound to affect me, and that obviously affect my family also. But again, I would divide it into two phases. In the early phase of my life, and as I have progressed in my career, in early phases, yes, I used to get more perturbed with all the situations. I used to be more apprehensive about it. But now, as I've gained experience and I've been dealing them quite regularly, although we do have that sort of apprehension, but that does not, I believe, is actually transmitted onto others, and we can do it in a more controlled manner.
That's a very important thing that we deal almost every day in our practice. As I said, I am a pediatric hematologist, so I see children with cancers. So sometimes that can be very difficult dealing these cases, especially with family and their relatives. So I would rather say that all my cases tend to be difficult cases, because it is children who are getting cancers and blood problems. So there is a lot of anxiety. So a large part of my discussion with families and their relatives involves a lot of counseling and reassuring them that once they have this diagnosis, what needs to be done and how can we overcome these diseases. Sometimes while doing them, obviously there are certain families who don't take it as well. So again, in those, I sometimes have to do multiple sessions. Over the time, while you deal with such difficult cases, you do need time after you have seen those patients in the late afternoon or evening, so to relax and maybe to wind down a little bit.
I deal with blood disorder patients, be it blood cancer or non-cancerous disease. Journey of blood cancer is a long one, and in that long journey, we do become part of the patient's family. So we get involved with the patient on a regular basis, and we get to know their family quite well and quite involved.